Melatonin gummies may look harmless, but accidental overdoses have increased more than 500% in the last decade. So here's what parents need to know before giving their child melatonin. I'm Dr. Lena Vanderlist. I'm a mom of two and a pediatrician with UC Davis Children's Hospital, and today we are discussing melatonin use in kids. Melatonin is a hormone that is produced in the brain. It helps regulate our body's circadian rhythm or sleep cycle. And for some, it has a hypnotic or sedating effect that helps get your body sleepy. It is also produced synthetically and available over the counter as a supplement. Melatonin use in kids should never take the place of good sleep hygiene, a regular bedtime, limiting screens, but we will talk more about this at the end of the video. Sometimes, despite good sleep hygiene practices, certain kids may really struggle with sleep. We see this much more commonly in children with neurodiversity, such as autism or ADHD, individuals with vision impairment, of course, our teenagers, or when you're traveling and changing time zones. There are studies that show minimal improvements with sleep onset and duration when on melatonin, especially in these high-risk groups. But before giving it a try, here are some things you should know. Melatonin in the United States is not regulated by the Food and Drug Administration. And because of this lack of regulation, it's really hard to know if the dose that's advertised on the bottle is really the dose you're getting. There are no studies looking at the safety of melatonin in kids younger than the age of 2, so we recommend avoiding it in this age group. There's also limited data on how melatonin may interact with any other medications your child may be on. So if your child does take medications, always discuss with your physician before using. And because of its popularity and the fact that it's frequently packaged as a gummy, accidental ingestions and overdoses have skyrocketed over the last 10 years. So side effects of melatonin, especially if used in excess, include drowsiness, headaches. At higher doses, we'll see delirium, nausea and vomiting, nighttime waking, dizziness, irritability, and bedwetting. This is an important reminder that melatonin needs to be treated like any other medication, locked away and out of reach of young children. So if you are going to try it, how much should they take? Interestingly, low doses, even a 0.5 milligram, seem to work just as well as higher doses. So we recommend starting with these really low doses and not going above 3 milligrams for children under 88 pounds or 5 milligrams for children over 88 pounds, unless specifically instructed by their physician. Now, about that sleep hygiene I mentioned, it's not glamorous, but it is definitely worth a try before reaching for melatonin. So kids should always have a consistent, age-appropriate bedtime and wake-up time. And create a consistent routine too. I love brush, book, bed. Brush their teeth, read a book, get in bed. Limit screen time for 2 hours before bedtime. Those bright lights actually suppress our brain's natural melatonin, so shut off the TV and the iPad. Make sure that your child gets some sun and exercise earlier in the day. For our teenagers, make sure they're avoiding caffeine in the afternoon. Take a warm shower or bath and let our bodies naturally cool down, which will help us get sleepy. And keep the bed as a place for sleeping only. You might be surprised how good sleep hygiene can make a huge difference. We talk more about melatonin in this episode of Kids Considered. Thanks for watching, and be sure to subscribe for the latest episodes of Little Lessons with UC Davis Children's Hospital.